Hello everyone, today we're going to be walking through a demo video of Kingdom Insurance Group's online custom quoting tool portal. As you can see here on the dashboard, we have several different tools we can quote for. They are all listed under here. We have Medicare Supplement, Medicare Advantage and PDP, Final Expense Life, Hospital Indemnity, and Dental. We also have e-applications enabled on this quoting tool, as well as a document locker and electronic scope of appointment. We're going to start by running a Medicare Supplement quote. In order to do so, we'll just click Run Quote underneath Medicare Supplement. This is where we'll enter our quote search. So we'll start by entering our zip code. Select the county if the zip code falls in multiple counties. Select our age, gender, tobacco status, and plan type. We can also choose how we'd like to sort the results by. We can sort by price, meaning they'll sort least expensive to most expensive by monthly premium, or we can choose AM Best or SMP rating, or the company name alphabetically. To learn more about AM Best rating or SP rating, go to their websites to learn more. We can also choose our effective date, so it will default to today's date, or we can move it out to say October 1st, and then we can see any plans that go into effect on October 1st, between now and October 1st. We can also choose whether or not to have the household discount applied, so I'm going to leave that as not applied for now. And then we can choose the client label. So this would be maybe the person's name. I'm going to type in here Jane Smith. So if we do a PDF export later, we can see that we ran this quote for Jane Smith, and it keeps it nice and organized and keeps it nice and professional on the printout. We can also click Show Advanced, and we can choose to apply underwriting filters. So under the health condition, we can choose maybe that they've had a heart attack. And we can add when this event occurred. So we can say, they had a heart attack in their whole life. We'd leave that at ever. Or maybe it just was, it was less than 5 years ago. They had a heart attack. We'll go ahead and add in when they had this incident occur. And then we'll click Add Filter. And we can see that it populates here under health entries. We can do the same for medications. We can select any medication they're on and choose the associated condition. And then we just want to be sure we click Add Filter, so it's added here under medication entries. To delete a health or medication entry, just click this X and it will be removed. We'll go ahead and hit Get Quote. You do not have to add in the health conditions or medications, but this is a great feature that we have for underwriting to see which carriers do not have these health conditions or medications on their knockout medication or drug list. So you can see here our results are listed here. It says that carriers listed below accept the following health conditions and medications. So that means that these carriers do not have a heart attack on their knockout drug list here. We can see these are sorted by least expensive to most expensive. So the top plan here is $104.71. It's Humana Insurance Company. It's Achieve plan. We can see the household discount if there is one, as well as the parent company, AM Best rating, rate type, plan type, SP rating, rating class, the years in market, and the effective date of this plan. So although we set 10/1 of 2020 for our effective date, we can see that the effective date of this actual plan was 11/1 of 2019. We can apply discounts here on the left-hand side and see what the discounted rate would be. We can see the annual rate. We can click Market Analytics to see age increases, increase history, and market data. And I'm going to go ahead and remove the annual rate so we can see our monthly rate again. You can see for age increases, this shows us what a person who's 66, 67, 68, or 69 years old would currently pay for this plan. So we can see for a 66 and 67-year-old, they don't really pay any more money than a 65-year-old. But once they hit age 68, the price does increase a little bit. So this is a bit of a way we can see a projection of how rates would increase as the person ages. Again, this is based on the current rate. Increase history, we do not have this for Ascendo here because it looks like they're this new plan here in March, so we don't have that in yet. If we scroll down to Continental Life Insurance Company of Brentwood, Tennessee, or Aetna, we can see the past increases that this carrier has taken. And then also the market data we see on a national and state level, the number of lives that are covered, the premium amount, loss ratio, and market percentage. We can also switch between years and see 2018 compared to 2019. And if we ever forget what these age increases increase history, or market data mean or what the definitions are. If we scroll down on the left-hand side of the screen and click About Quote, we see this nice little cheat sheet that has definitions and sources of the following data. Again, that's the About Quotes on the left-hand side. If we would like to remove the underwriting filter, so remove this heart attack, we can click this and it will go away, and then it will show 100% of the results. So we can toggle back and forth between seeing the results for heart attack and seeing this would be the results for heart attack listed here, or removing that to see 100% of the results. We also have application health questions. So if we click any heart condition, for example, and we scroll down, we can see what the look back period is on the application. So for example, we selected any heart condition. It's saying that for these different carriers, it's not on the application. And some of these, it will actually have a year or a time frame. So for United World Life Insurance Company, you can see for heart attack, it asks if they've ever had a heart attack. So we said this person had a heart attack in the last 5 years. This application is going to ask if they've ever had a heart attack. If we have, or our applicant has, we'll have to go ahead and put that down. But maybe it would say the look back period is 10 years. Well, if we had a heart attack 15 years ago, we would not need to disclose that on the application. So that shows us our look back periods based on the carrier's application. We can also filter quotes by whether or not they have a household discount. So we can click containing household discounts and include the filter, or we can do ones without a policy fee and include the filters. We'll scroll back to the top here. If we click quote options, we can view the plan details, which would show us our Part A and Part B, or Parts A and B our plan details here, and print that out. We can also download the PDF application, so the actual PDF application for this carrier. It'll show us a little document viewer here, so we can take a peek at that application and decide whether or not we'd like to download this. And then of course we just click this download button or print. If we hit the back arrow, we can see that we can also visit the carrier resources, which would be the carrier's online portal. So if we click Humana's website, and of course we do have this Apply Now button. So if we wanted to start a new e-application for a Medicare supplement plan, any of those plans have an e-application available, will have this Apply Now button listed. And in order to start a new application, we'd simply click this Apply Now button. The first time that we're starting an e-application for a particular carrier in a particular state, it will ask us to validate our producer number or writing number. You can see that I've done an application for this carrier before, so it automatically remembered me. It has my name and producer number listed here. And then we're already in the application. So we don't go to the carrier's website, we're right here in the portal, and we can start the application. So we can say that we're in an open enrollment period. We'll say that we're not covered under Medicare Part A, but we will list our effective date, or our eligibility date rather, for Part A and Part B. We'll go ahead and hit continue. You can see that on the quote here, it shows the carrier, it shows that we have a Plan G and what the rate is for a female age 65 non-tobacco user. And as we move through the application, it's a smart e-app, so it will automatically update in real time. We'll say that we heard about this plan from social media. So an example of this updating in real time is if I switch this to a Plan N, let's say, it's going to go from the $115.67 of a Plan G, and it's going to update the rate. Let's make sure that this updates. When we click the next button, hit continue, it will update for us here. Our requested effective date is 10/1/2020, and that carried over from when we ran the quote. We'll enter our applicant's name, her address, our zip code, city and state, again pulled from where we ran the quote. We'll say our mailing address is not different. We'll enter our phone number for our applicant. Their email address, I'll enter my email address. Our age, date of birth, and our gender, our height and weight. And for some carriers, this will update. So if the person maybe has height or weight, or that would push them into the next level or rating class. If it's going to make the plan be more expensive for them, maybe they're overweight or something, then it will update it will actually update the rate here that they're paying, if maybe it bumps them into a different rating class. It will ask us if we're a tobacco user, if we'd like to receive our EOB online and go paperless, and if we'd like a temporary ID card. So all these questions are pretty self-explanatory here. They're all based on the carrier's questions. So although the process is the exact same for each carrier, the questions will vary based on the carrier. We'll hit continue, and you can see that as we finish each section, we get a green check mark telling us we're good to go. If we have a section that needs information still, it has this yellow exclamation point, or it's blank if we haven't started it yet. It's going to ask if we would qualify for a household discount. We're going to say no. Again, if we look here at the top where it has our quote, we can see that the rate went down since we selected Plan N. As we hit continue, it refreshed, and now it's showing $95.39. We'll enter our social security number. If we're covered under Medicare Part A and Part B, it says no, and it has our eligibility date since we already entered that, it pulled that over. Did we turn 65 in the last 6 months? We'll say yes. And Medicare Part B in the last 6 months, we'll say no. And you can see I'm moving very quickly through this e-application, so it's a very quick application. Just takes a few minutes here to go through the entire application. Now it's going to ask our previous or existing coverage information here. I'm going to select no for these. We'll hit continue. And you'll notice we're already at our method of payment. So we're already through the application questions. Will this be a wet signature application? We can print this as a PDF for a wet signature if we'd like, but most cases we're going to say no. We're going to use actual e-application functionality. If we do a wet signature, we can mail a check. Otherwise, we have to select automated bank account withdraw. We'll say a checking account. We'll enter in our routing number, our routing number. We'll say it's this First National Bank of Omaha, our account number, our first name, or our applicant's first name, our applicant's last name, and then we can choose whether we'd like a direct bill or automatic bank account withdraw. And I'm going to choose a particular day. I'm going to choose the first day of the month, so we can customize all of that when it's going to be drafted from our account. We're almost through the entire e-application already. We're going to go into this to be completed by producer. We can choose where the policy is delivered, so the applicant or the producer. We'll say producer. We've read and accurately recorded the application information, and we interviewed the proposed applicant. We can add notes to underwriting, upload any supporting documents such as a notice of termination or evidence of insurance, and choose those files from our computer. And once we've entered everything and we see we have green check marks all the way down, we can verify application. Now, if we would have entered anything that would have disqualified us from coverage, maybe certain health questions on an underwriting application, we would get these notifications here at the top and they would be red here. So we would be notified if we entered anything that would disqualify them from coverage. Again, more likely they're in a full underwriting situation with those health conditions or health questions. So it notifies us right away, which is nice that it underwrites in real time in those situations. So we'll review our information. We see that it's complete. We can edit these sections if we see anything we need to update. Otherwise, if everything looks great, we can go ahead and lock and e-sign, or we can print for signature again. What did we miss here? It's not in good order, so we must have missed something here. This is a perfect example of it catching it for us. So because I am not a real producer here, we're not going to actually submit this, but what we would do is we would go ahead and lock and e-sign this if we were ready to go, or print for signature. And our email address we entered for the application is where it would be emailed. So we want to always double check that email address we enter for our applicant, because when we do this lock and e-sign, it's going to be emailed to the applicant with a link and a verification code, and they will click that link and enter the verification code, and that is how they would sign. So once we would sign this here, again, I'm not going to submit it since I'm not really a producer. I don't want to submit this here to Mutual of Omaha or United World Life. So that is how we'd go through the steps. Now I'm going to show you the e-application dashboard where you can see any applications that are incomplete or submitted. So I started this one earlier this morning, and here's the one we went all the way through together. I can go back in and edit the application to finish it, or I can delete it out. Now, if I would have submitted this application, we would have a policy number and it would say submitted, and this would be green here. So that's where we can track any applications we've started or completed. We can also search for these applications by the first or last name. So that's the e-app. Let's take us back to the dashboard here and we'll go into our quoting tools. So we did Medicare Supplement and Medicare Supplement e-application. If we want to go into the e-application dashboard where we just were, we'd click View Active and it would take us back into our applications. So if I hit the back arrow, here's our tool dashboard. I'm going into Medicare Advantage. I'll click Run Quote, enter the zip code, select our county if there's multiple counties, choose Medicare Advantage, Medicare Part D, or Special Needs Plans. We can choose our filter, so we can filter by HMO, PPO, Enhanced Drug Benefit, or No Drug Benefit. I'm going to choose all of the results. Choose our effective year and how to sort by, so price or company name alphabetically. We can also choose our income subsidy level. So I'm going to say 75%, and I'm going to say Jane Smith again, and hit Get Quote. So you can see that the process for running a quote is the same, and the results page looks a lot the same. So the functionality is the same tool by tool, which makes it really easy to learn and to remember how to use this quoting tool. We can see these are $0 premiums, so it's sorted by max out of pocket. We see the premium amount, carrier name, plan, star rating, drug deductible, drug benefit, plan type, gap coverage, county, and the plan ID. We can also see the annual rate if there is a premium. Market analytics, this would show us the county penetration and company enrollment for the past several months. We can do quote options and see the plan details for each of these plans. And we want to make sure that we click show additional details here. Otherwise, it's an abbreviated list of these plan details. So up at the top, if we click show additional details, we'll see everything that's available with this plan. It's a much longer list of details here. We can always do a PDF of this page. So we can either click PDF or print. I'm going to hit back here to get back to our Medicare Advantage results. Another great feature we have for all of our quoting tools is this compare quotes. So we can click on each of these plans up to 5 at a time. I'm going to click 3. Notice they turn green, and in the upper left-hand corner we can click compare quotes, and it will show us a side-by-side comparison of the plans we selected. Again, we can do up to 5 at once. I just did 3 here, and we can see that it shows us a side-by-side comparison of our 3 plans. Again, we can do a PDF download of this page or print this page for our client. I'm going to show you a PDF version of this so you can see how this would look, and that it will include Jane Smith's name. So see at the top it says quote comparison for Jane Smith since we entered her name. Let's take a peek at this PDF. So it has my name at the top as the agent, Taylor McDonald, my phone number, email address, the quote we ran, and then it shows my picture here that I can upload, and it shows a side-by-side comparison of the 3 plans. So a very nice professional printout that you can give to Jane Smith here and be able to let her review her plans. I'm going to hit the back arrow. If we want to clear out any of these plans under compare quotes, we simply hit the X. And we can also do a universal compare. So compare quote, as we just showed, was for Medicare Advantage plans versus other Medicare Advantage plans. But we can actually do a comparison for different plans. So maybe a Medicare Advantage plan with a final expense plan. We can click this universal compare, and it will save it under universal compare. When we run a different product, such as dental, we click this globe again to turn it purple, and we can compare different product types next to each other. So that's universal compare. We also have a great fill the gaps feature. So I'm going to go into my plan details, and we can actually click fill the gaps, and we can run a hospital indemnity quote to fill in the coverage gaps of our Medicare Advantage plan with a hospital indemnity plan. So I'll click Run Quote. I'll select my hospital indemnity plan, click Add to Comparison. Wait for him to load here, this tool. And then you can see that we can actually add in different benefit amounts, and it will show how it will add how it will affect the price here. So emergency room benefits, we can add in any different benefits here that we would like, or outpatient surgical benefits. We can select our different amounts, see $750 for $250, or it goes up to $30 for $1,000 a day. So we can actually customize our plan for our applicant or for our client, and we can actually print this or do a PDF download of this as well. I'm going to take us back to our Medicare Advantage quote results. And it's going to function the same way as if we did a Medicare Part D. We can make any changes at the top and hit Get Quote. So maybe we want to change our plan. Again, we can just switch this at the top and hit Get Quote, and it will show us our results for Medicare Part D. And same for the special needs plans. Just make any change at the top and hit Get Quote, and you can change what you're seeing here. I'm going to take us back to the dashboard, and we're going to move into the final expense life. Again, after you've seen one of these quoting tools, you can see it's pretty similar for the other products as well. We select our zip code, age, gender, tobacco status. For final expense, we can choose our face value or a monthly rate. So maybe they only want to pay $30 a month. We can add in $30, and it will only show plans that are around the $30 benchmark. We can choose our product type, our underwriting type, and how we'd like to sort the results by again, and we can add a client label. We'll hit Get Quote, and again, we'll see that the monthly rate of these plans is within that $30 a month monthly rate, or we could have chosen the face value here. So all these plans are under $30 since we added that for a monthly rate. We see the monthly premium, the carrier name, the face amount, the annual fee, the plan, AM Best rating, parent company, S&P rating, the years in market, and the underwriting type. We can click Apply Fees to see how, then when we click the Apply Fees, these are all going to be $30 a month since that's what we selected. And we can choose to see monthly rate, quarterly rate, or semi-annual rate. So again, very similar quoting tool features across the board. We can do the plan details as well, or go to the carrier's website as we did for the other plans. Hospital indemnity. We enter our zip code, age, gender, and tobacco status, how we like to sort the results by, and again, we can add that client label if we would like. Hit Get Quote, and we'll see our hospital indemnity plans listed here. Again, listed by premium amount. We can see the base plan, the hospital confinement benefits, the included benefits. Everything's listed here. We can view our plan details again, as we can for every single plan. And we can actually, for these hospital indemnity plans, choose our benefit amounts and see how it affects the price. So we can do that for all these different benefits. We can do a PDF download or print of just a single plan. Or for any of these quoting tools, we can also always do a print or PDF download of the entire list. So that's up to you if you'd like to do an entire export. We can do the compare quote as we did before for the Medicare supplement. So we just select our plans and hit compare quotes to see them side by side. Take us back to the dashboard again, and we'll see what the dental looks like. Again, it's very similar to our other quoting tools. Enter the zip code, age, gender, tobacco status. We can also choose how to sort the results. We can choose if we want dental and vision or just dental. We can choose our covered members. So I'm going to just do a dental quote here with just the individual coverage. And we can see our plans listed here. Again, for the dental e-app, we would just click Apply Now. So we would go into our quoting tool right away to run the quote to start a new dental e-app, and then choose under the plan we would like. Again, I'm not registered to write a dental e-app, but it's going to work almost exactly like the Medicare supplement e-application. So that's our dental e-app button there. We'd click Apply Now. We'll take it back to the dashboard here. So those are our quoting tools in the Medicare Supplement e-app. I showed you how to start a dental e-app, and again, it's going to work very similar to the Medicare Supplement e-application. I'll take us now into our Document Locker and ESOA tool. So to go into Document Locker, we'll click View Files, and this is where you can store any documents. So it was designed to store the electronic scope of appointment forms that you can also create from this tool, or you can actually upload any documents you have on your desktop. So maybe you've got a big stack of current scope of appointments on your desk and you want to clean those up. You can scan those on a scanner and upload those, or if they're on your computer desktop, you can upload them here. And then you can choose files to upload into this Document Locker. You can create folders. So maybe we want to say these are going to be our 2020 AEP docs. If I can type here. We'll click create. And you can see we have now a folder here, 2020 AEP docs. And then I can click this scope of appointment. I can move it into any folder I'd like to. So you can move around different documents into your different folders. You can export the entire document locker of any documents you have here. And then the biggest piece of functionality that we can do here is create an electronic document or electronic scope of appointment. So to do that, we'll click Create Electronic Document. And you can see any incomplete scope of appointment forms here, the name of the project, the status, so if they're awaiting the producer data or awaiting a signature, the last modified or created date, and then we can actually delete any incomplete scope of appointment forms here. If we don't want them any longer, we can simply click this button to delete them out. And to start a new document, we'll just click Start Document to start a new scope of appointment form. And then we can title this. We'll say it's for Jane again. And we'll title this and then click Save and Continue. And then we'll go ahead and agree to the terms and conditions. If we are in the same physical location as our client, if we select yes, they can actually do applicant provides identifying information, so their mother's maiden name and last four of their social security number. So if we say that they're together, they actually don't need to do an email signature. If they're with us, we can do, again, mother's maiden name, last four of their social, and that counts as a signature. If we're not in the same physical location, which is generally going to be the situation here, we would do the email signature link. So then we type in the applicant's email address. And then what would happen when they receive this in their email is they're going to get an email that has a link and a verification code. And in order to sign, they're going to click that link in the email and enter the verification code. So it's just going to be a very simple email. They click the link, enter the verification code, and that's how they sign. I'm going to do the same physical location today, so I don't have to open up my email address during this demo. So I'm going to say that they provide the identifying information. And you can still see the functionality of how this works. So the applicant confirmation form, we're going to say we're talking about dental and hearing products. The applicant's name is Jane Smith. We'll say the mother's maiden name here. So this is where they would actually be signing. So last four of their social, the city, the state, zip code, and we're going to apply e-signature. So sign and continue. And then we're going to do the agent name, the beneficiary name, address, the agent phone number, the beneficiary phone number, the beneficiary city, state, and zip code. And we're going to say maybe they were a walk-in. And the plans, we'll say Aetna Mutual of Omaha. We'll just make up some carriers there. And then the date the appointment was completed. And if the form was signed by the beneficiary at the time of appointment, we can say why the SOA was not documented prior to meeting, but that doesn't apply here. We'll say that doesn't apply. So we'll click continue. And then this is me, the producer, applying my signature. So I type in my first and last name and click sign. So now that I've completed it on my end, it's going to be sent, or it's actually been signed already because we did not need to send them the email. But if we were doing the email signature, they would receive that email with the verification code and the link. They'd click the link, enter the verification code, and it would tell us that we're awaiting the signature of the applicant. But since we said we're in the same physical location and they're with us, this is already completed, and we can click Save to Library. We can also see the document preview that was filled out. So all the information we put in here is now filled out, and we'll go ahead and save this to our library. And then we'll see it when we're in our library right here, Jane Smith SOA. We can download it, we can preview this, or again, we can move it. Maybe we want to move it to our 2020 AEP docs, and then we can click move, and it will go into our folder. Again, we can upload any folders or any files into this document locker. We can also create new folders. We can export the document locker library if we ever want to export the files that are here. I'll take us back to our dashboard. We've covered everything here. So we've covered our quoting tools from Medicare Supplement, Medicare Advantage, Final Expense, Life, Hospital Indemnity, and Dental. We also walked through the Medicare Supplement e-application. We showed you how to start a new dental e-application, and we went through the document locker and electronic scope of appointment. From this page, we can also click sign out. We want to make sure to do that after every session. And we can also go into our own account settings by clicking our username. And this is where you can update your first and last name, your phone number. You can choose a picture here or type in an agency name so that when you do the printouts, you can see your picture for your clients. They can remember what you look like, and it has all your information listed here. That's where you update this information. Thank you so much for watching today's demo of Kingdom Insurance online quoting tool. Also includes an electronic application, an electronic scope appointment. We hope you have a great day, and thank you for watching.